Namaste. Welcome to today's Yes Talk. The title of today's talk is Why Drown in Alcohol? Staying Afloat No Matter What. The speaker is Dr. Ramesh Bijlani, who is a prolific writer and an inspirational speaker. He holds a master's degree in nutrition from MIT, USA, besides a doctorate in physiology from AIIMS, New Delhi. Once a professor at AIIMS New Delhi, Dr. Bijlani is now a spiritual seeker at Sri Aurobindo Ashram, Delhi branch. Dr. Bijlani, thank you so much for sharing your valuable time with us. We look forward to an interesting session with you.
Thank you, Arunima. The topic today, that is alcoholism, is of general interest to those who drink and those who don't drink. And of course, there is no hard and fast division between those who drink and those who don't, because the whole wide spectrum, some are only occasional drinkers and some have severe alcohol dependence. Now, why it's of general interest is because even if we don't drink, there's hardly anyone who does not know someone in the family or amongst close friends who not only drinks but has also been the victim of severe dependence on alcohol, leading to serious physical, social, or psychological issues. And in all such cases, by and large, when the person is asked why the person drinks, the reason may be that the person started just for the heck of it. Maybe he was in bad company. Of course, he never thought it was bad company. It's only others who think so. Or uh, he wanted to be a part of the crowd. It seemed to him a social necessity because everyone at the workplace, at a party, and so on was drinking, and he didn't want to be the odd one out. But no matter how it started and what the reason was, when the alcohol dependence becomes severe, usually the reason given, which may be sometimes an excuse, is that what can I do? I have so much stress. That's why I have to drink. And when the person says, I have so much stress, what the person means is that either the person is thinking too much, brooding too much over the past, has plenty of regrets about the past, or that the person is having some sorrows in the present, or the person has some anxieties about the future, and the person is trying to drown these in alcohol. But then if this process continues long enough, which it generally does because of the dependence the person develops on it, because at least for a brief period, the person can forget about everything and he thinks that all these problems have disappeared. But then, if this process continues long enough, he finds that instead of drowning these problems, he himself is drowned in all the problems which are far more serious than the problems which he was trying to drown. So, in other words, he himself is drowned in those problems. Now, what is the solution? The solution is that this person should turn to spirituality. In fact, that is the ultimate answer. Why? Because if we look at the past about which the person has regrets and he's trying to sort of brood over them, the constructive way, the spiritual way of looking at the past is that firstly, nobody can change the past. But at the same time, whatever happened in the past, which may not have been pleasant, could have been an opportunity for spiritual growth. It could have been a teacher. The person can reflect whether I made good use of those opportunities. And if the person did, the person can see something positive in what happened. And if the person did not make full use of those opportunities, which also can happen because we waste so many opportunities in life. So if the person did not make full use of them, then the person has again learned something and he can use at least the present in a better way. Whatever circumstances he has now, he can use them in a better way for spiritual growth, which actually is the purpose of life. So he may have some regrets in terms of not having made use of the opportunities of the past, but he doesn't have the type of regrets which we'll have at a mental level. If only it had been so, if only it had not been so, it will not be that type of regrets. Again, when it comes to the present, the person can, if even if the present is not very pleasant, the person can use it as an opportunity for spiritual growth. And if the person does that well, many of the anxieties of the future will automatically disappear. Because with this new bent of mind, with trying to look at everything through the spiritual lens, the person will find that at the mental level, there's no guarantee that the future will be happy, the future will be as the person wants. There can be no guarantee because so many things could turn out to be wrong, and they could turn out to be wrong in totally unexpected ways. And therefore, the person comes to the conclusion that I can leave it to the divine. If so far everything has been either good or has been an opportunity for my spiritual growth, that is what will happen also in the future. And therefore, I don't have to worry about the future. To the extent I can work on the present now so that the future is better. But beyond that, I don't have to worry. In spite of how I use the present, the future is not in my hands. It's unpredictable, and I'm quite happy with it. So that is the ultimate solution. But then that is not the topic today. So I'll not dwell too much on that and instead turn to the PowerPoint to see uh, how a person tries to solve many of these problems using alcohol and what the consequences are. So let me start with this rather funny quote on alcohol. Alcohol gives you infinite patience for stupidity. So in a way, at least it does something positive. It gives infinite patience, which is a great virtue. But patience with what? With stupidity. Whose stupidity? Stupidity of the person who is drinking. And why does that happen? Because the person has become so stupid that he does not even realize that he has become stupid. And that's why he goes on tolerating it and displays infinite patience to his stupidity. Now, being a medical person, let me turn to the biological effects of alcohol, and I'll go over them fast. The acute effects, that is, the effects seen quickly after ingesting alcohol, are due to depression of the central nervous system. Now, this may look a little surprising uh, to the general public because normally we think that after having alcohol, the person becomes, in fact, more talkative and more aggressive and violent and so on. Now, that looks like stimulation rather than depression. Now, this happens because, uh, if we look at the brain, it is the most highly evolved parts of the brain that are the most sensitive to this depressant effect. And what is the function of these most highly evolved parts of the brain? The function is to inhibit the basic behavior. To start with, if you look at the evolution of the brain, the person's, the animals had the brain stem which controlled breathing and the heart. Now, these are functions which are essential for survival. Then came a layer over it which was controlling emotions. And then came still another layer which was responsible for thinking and civilized behavior. And that is the part that is the cerebral cortex, which is best developed in human beings. Now, this part, apart from giving us the ability to think and so on, also inhibits some of the basic aggression and violence, which is rooted in the emotional part of the brain, which is relatively primitive. And one can understand why the body is so constituted that to any insult or injury, it is the most highly evolved parts which are most sensitive because they are less important for survival. So that gets depressed first. And if the dose is higher, then the next part, and then last of all to be affected are the parts which control the heartbeat and breathing. Because if that is depressed, the person will die. So therefore, there's a long gap between the person cerebral cortex getting depressed and he feeling sort of release from that inhibition and becoming talkative, etc. And then only if he increases the dose further, it goes further down, and that is how is this depression actually shows up as a sort of stimulation. So that happens because the most highly evolved parts are affected first, and the primitive parts are affected by any injury or insult to the nervous system later. So becoming talkative, abusive, aggressive, or violent is not due to activation of the brain, it is due to removal of inhibition. The way children in a class in school might become very noisy when the teacher has gone. So the inhibition of the absence of the teacher, the inhibition of the teacher, absence of that inhibition, that makes the children more active and talkative. So here also it's a uh, removal of the inhibition, or what is technically called disinhibition. So disinhibition may be considered disabling of the inhibition. So that's why the person becomes apparently more active. Now, it's interesting to compare the effects of alcohol with that of an anesthetic. Now, let's concentrate on alcohol first. Uh, the person takes alcohol, and for the reasons which we just saw, the person experiences some fun. All the sorrows are gone. He becomes looks happier, more talkative, aggressive, and so on. And in that process, in that euphoria, he is having fun. He forgets the sorrows, and that is what he enjoys. Now, if we increase the dose, we find that eventually uh, comes a point when the person becomes unconscious, when relatively lower parts of the brain have also been depressed. But then this unconsciousness is in a way a protective mechanism, because after that, the person will not be able to take more alcohol. If he's unconscious, he can't drink more. And therefore, he'll not go to the level where the breathing and heart will stop and the person can die. But all the same, after the person becomes unconscious, the person may die due to other reasons. He may vomit, and since he's unconscious, the, uh, the vomiters, instead of coming out, may get aspirated into the lungs, and that's how the person may die. So the person can die, but generally, since after being unconscious, he cannot drink anymore, it is not alcohol which stops his heart or uh, stops his breathing. But then there's a long gap between his having this fun and becoming unconscious, and therefore he can go on increasing the dose and still he does not become unconscious. With the anesthetic, it's very different. To start with, the person has fun to the same reasons. Anesthetics are also central nervous system depressants, but just a little more, and then the person becomes unconscious. And then it takes a lot more of the anesthetic before there is stoppage of breathing and the heart. And this is very useful, because the person is we want the person to be unconscious, and therefore the shorter the gap between getting more aggressive and becoming unconscious, the better. And also the longer the gap between becoming unconscious and the heart and the breathing stopping, the better, because you can go on giving more of the anesthetic, which will make the person more deeply unconscious, become even less sensitive to pain, but his breathing and heartbeat will continue. But essentially the process is the same. So both of these give us, for the longest duration and longest sort of window of safety, that is, you can go on increasing the dose and get what you want. In case of alcohol, the person wants fun, and he can go on having that fun long before he becomes unconscious. So there's a big window available here. On the other hand, here, the window is required between becoming unconscious and the stoppage of breathing and of the breathing and the stoppage of the heart. So you can go on giving more of the anesthetic, and it will be a long time before there is stoppage of breathing and the heart. And in fact, the best anesthetics are those in which the phase of the fun is hardly there. You don't even observe it, and quickly the person is unconscious. So that is how the anesthetic acts. But at the same time, why this is important to understand is because the first anesthetics to be used were also being used for having fun. Because if the person has a little gap available here, during that the person can have fun. And if the person becomes unconscious, even that it doesn't matter, because after that the person will not drink, he will not die, because the breathing and the heart will stop much later. And therefore, he may become unconscious as the effect of the drug wears off. He'll become conscious again. So that's why, as some of the anesthetics were used, in fact, for having fun. In the 1770s, it was common to have what were called ether parties. And later on, ether came to be employed as an anesthetic. Of course, now ether is out of date. There are much better anesthetics available. But in the 17th and 18th century, there were ether parties. And by the middle of the 19th century, some people realized, why not use this little window when the person is unconscious, for doing painless surgery. And one of the first ones, although not uh, above controversy, is Dr. Morton. And it was a big event a big demonstration was arranged at the Mass General Hospital in Boston for people to see that here is a drug that has been discovered, which, if inhaled, can make the person undergo complicated surgery. And of course, before that, there were dental extraction done. Dental extraction and even long, complicated surgery can be done without the person feeling any pain. So here you can see an ether party, a picture of an ether party. The person inhales something, and then you can see he's having some fun before he becomes unconscious. There were not only ether parties, there were also similar events organized with nitrous oxide, which is also sometimes called laughing gas because of reasons you can understand. The person becomes happy because of removal of that inhibition, he may start laughing. Now, this is a gaseous product. Nitrous oxide is a gas. So there were these parties also. And uh, now, of course, nitrous oxide has also completely disappeared as an anesthetic, more or less. But as a child, I remember there were two types of dentists. One type of dentists gave an injection to anesthetize the gums so that they can work on the teeth. Another type of anesthesia used by dentists was nitrous oxide. No injection was required. It was sprayed on the gum, and then the dentist could work on the tooth. And the children liked that. As a child, at least I liked that very much. No injection required. And the feel of nitrous oxide is very cool. So you feel something cold being sprayed on the gum, and then the doctor is working on your tooth and you don't feel any pain. So nitrous oxide parties, ether parties. Now, neither there are such parties, there are only alcohol parties, nor are ether and nitrous oxide used as anesthetics, but all the same, uh, it's interesting to know a bit about this and see the similarities between the effects of alcohol and the effects of anesthetics. Now, continuing with the acute effects of alcohol, the person has disturbed sleep, and he has a hangover the next day. And some of the symptoms of the hangover are headache, anxiety, depression, feeling excessive thirst, and an upset stomach. And apart from the disturbed sleep and hangover, the person's abstract thinking may be impaired for up to a month. The rest of the hangover may be over in a day, but the impairment of abstract thinking can continue up to a month. If a person is a regular drinker, then not only it continues up to a month, but gradually the effect is cumulative and the person becomes less and less efficient at mental work. Now, this is something important, particularly for students to understand, because many young people are also drinking these days, that it is not that the hangover is over and now they are fine and they can have another drink the next day. It's not, or maybe they have not enough to have much of a hangover, so they think all is fine. This impairment of abstract thinking can happen even if there's no hangover, and it can continue for a long period. And if the drinking is frequent, it can not only become permanent, it can keep getting worse. So mental function can suffer seriously because of alcohol. Now, does alcohol give any energy? Which means, does it work like food? Yes, it does. It gives 7 calories per gram. And for comparison, carbohydrates and fats give 4 calories per gram, and fats give 9 calories per gram. Alcohol gives something between the two, about 7 calories per gram. But then these are empty calories. They are not accompanied by any vitamins or minerals or any such thing. But then if the quantity ingested is quite large, either if the person consumes a normal amount of food, the person will put on weight, or if the person reduces the rest of the food, the person can get deficient in essential nutrients like vitamins, minerals, protein, etc. Now, does alcohol help in dealing with cold weather? It's a common feeling that maybe those who live in cold weather, they need more of this alcohol. But then that is a misunderstanding. It does not help in dealing with cold weather. Why we feel so is because there's flushing, etc., of the skin. More blood flows through the skin, and the person feels warm. But that actually increases the heat loss from the skin, the way it would happen when the person is in hot environment. So the person is in a cold environment, but the body reacts in such a way because of the warmth as if it is hot, and therefore there is flushing of the skin, more blood flow through the skin, and the person can lose more heat through the skin, which is not good in cold weather. It is something that we need in hot weather. In cold weather, we need the less blood flow through the skin so that there's less heat loss from the skin. But then why the person is generally not affected is because most of this drinking is indoors where it is not very cold. It may be cold outside, but it is not cold inside. But then if the person takes another drink just before going up to the car and thinks that this drink will help me because it will make me warm, that actually doesn't work. It could be dangerous. And therefore, alcohol does not help in dealing with cold weather, although it may seem to do so. Uh, Actually, it does just the other way around. When the body should be working to fight cold, it makes the body feel as if it is hot, and that only confuses the body and can make it difficult to withstand cold weather. Now, coming to the long term effects, these were the acute effects, long term effects. Uh, as we saw a short while back, there are effects on the mental function, and they start showing in the structure. Structurally, the brain shrinks, it becomes smaller in size, and there is greater tolerance to alcohol, which means to get the same amount of euphoria, the same amount of fun, the person needs larger quantities. The body can tolerate larger quantities. Not only it can tolerate larger quantities, it needs a larger quantity to get the same effect, the effect which the person is looking for, that is feeling good. To feel good, the person needs a larger amount. So this is a type of tolerance which is not really good. It would be much better to have some intolerance to larger doses of alcohol, which also some people have. And that is, in fact, one of the ways in which alco- uh, severe alcohol dependence is sometimes treated. A drug is given which does not reduce the craving, but after taking this drug, just a small amount of alcohol leads to vomiting and other unpleasant effects. And so the person develops an aversion to alcohol if he thinks that, well, now something has happened to my body. My body is not tolerating alcohol anymore, just a little bit, and I feel so unpleasant. So we create that intolerance to alcohol to treat it. That is how one of the drugs acts. One, the universal long term effect, which almost anybody who drinks long enough and will is likely to have is liver disease. Long enough in significant amounts. What those amounts are, we'll see. But liver disease is the commonest long-term effect. But then apart from this liver disease, there's hardly any system in the body which is not affected at all by alcohol. The person may get high blood pressure, stroke, heart disease. The risk for all these increases. Now, at this point, one might go to this question, which some of you may have, because it is there in the literature. Does alcohol offer any protection against heart disease? This came from the French paradox. French paradox because there are some areas in France where drinking wine, which has a relatively low alcohol content, is almost universal. And the mother has said, actually, at some point, she was from France, that in that region of France, people take wine almost like water. Instead of drinking water, they keep having wine. They develop tolerance to alcohol. It doesn't seem to do them anything, but does affect their brain. And the result is that they eventually get some psychological issues, mental problems. So it eats away their brains. Uh, but then how about the heart? These people seem to have less of heart disease than the general population or than those populations which do not take wine so regularly. Now, to get liver disease or to get brain disease is not something which one can bargain for just to get a little protection against heart disease, which is not really worth it. Secondly, it is not sure to what extent it is the alcohol in the wine or any type of alcohol that protects against heart disease. It may be because at least the person gets some temporary relief from stress. So it may be the stress reduction that offers that protection, or the wine is made from grapes, and it may be the antioxidants in the grapes which are helping, uh, which are protecting against heart disease. So if that is so, why not have grapes instead of having the wine made from grapes? So these are some of the questions which can be raised, and the overall conclusion is that even if there is some protection, some little protection against heart disease, which may be offered by limited amounts of alcohol, it's better not to take that because one cannot stick to that limited amount. There's a tendency to go on taking more and more. And the protection against heart disease is also dose dependent, which means very small amounts do not give the protection. Larger amounts do give some protection, perhaps, but then still larger amounts reduce that protection and, in fact, make the person more prone to heart disease, high blood pressure, and stroke. And secondly, the effect may be indirect. It may be because of stress reduction, or it may be because of antioxidants. And whatever little protection may be there doesn't come free. It comes at a cost. It comes at a cost which is heavy. Liver disease, heart disease, uh, hypertension, and stroke. Now let's come to some more long-term effects. There may be myopathy, that is weakness of the muscles, including cardiomyopathy. If the weakness of the muscles affects the heart, one can imagine what would happen. And reproductive function is particularly impaired, leading to impotence in men, increased risk for breast cancer in women, and increased risk for prostate cancer in men. And then the baby is adversely affected during pregnancy if the mother continues to drink during pregnancy. And alcohol is also passed on to the baby through the milk if the mother is nursing the baby during lactation and the mother is taking alcohol during lactation. That also gets passed on to the baby and does the baby quite a bit of harm. So, therefore, during pregnancy and lactation, women should not take alcohol even if they do otherwise. Other long-term effects are impaired immunity, which may mean repeated infections, and also cancer, because cancer also is partly because of impaired immunity. And apart from the cancer of the breast and the prostate, which we saw, two other cancers which are quite associated with alcohol, apart from, of course, liver cancer, because liver disease may not stop with cirrhosis, it may go to liver cancer in some cases. But apart from those cancers, the other two cancers which are associated with alcohol are cancer of the food pipe or the esophagus. And we find plenty of it in the hilly areas in India where drinking is pretty common, and the pancreas. And an indirect long-term effect of alcohol may be malnutrition, because the person is taking quite a bit of alcohol and therefore does not feel the need to take much of normal food, because alcohol itself gives energy, as we saw, 7 calories per gram. Also, if the person is uh, not very rich, or belongs to the lower socioeconomic strata, then because of the expenditure on alcohol, the person may not even have enough money to buy proper food, and therefore malnutrition, not only for the person, but sometimes also for the rest of the family that does not drink. Now, are these long-term effects of alcohol reversible? Not completely, only up to a point, and they're not guaranteed. Now, coming to behavioral or psychological effects of alcohol, we saw the acute effects is that the person may get aggressive, abusive, and violent, and the brunt is borne often by the family, most commonly the wife and the children. Then the effects on driving, and that's why uh, one should never drive after a drink. Now, this is something which is something of personal interest to me, because as a medical student, one of the best books that I read was a book on clinical pharmacology by Professor Lawrence. And this book was illustrated by Peter Kneebone. And you find on the right one of the pictures showing the effect of alcohol on driving. Why these two people are important is because apart from Dr. Lawrence being a pharmacologist and Peter Kneebone being an artist, both were very learned men, both were widely read, and both had a good sense of humor. And that's why the book read more like a piece of literature than a textbook of pharmacology. So said that you could read it like a novel at bedtime. Now, let's quickly go over this diagram, which is one of the best known diagrams from this book, which shows the effects of alcohol on driving. Uh, Here, number one, the person has an inability to deal with a crisis. Now, here are some animals on the road. That's a crisis. The person gets confused, can't deal with it properly. Now, I think number two should be somewhere here, which is the tendency to have accidents on one's own. The person has hit a lamppost. And then comes three, increased distractibility. Poor women, as if they are the only distraction one can have, and the drivers have to be all men, and the distractions have to be all women. But anyway, that's how pictures are drawn. And then here, this is the fourth thing that could happen. Uh, and the fifth, either excessive caution, the person is behind a horse driven cart and he becomes overcautious and just stays behind it instead of overtaking it. Or maybe overconfident, there's a car in front of him which is only slightly slower than he wants to be, and there is not enough space for overtaking, still he dares to overtake. So either excessive caution or overconfidence. Then number six, steering wheel movements which are not really required. So you can see all these. He can't keep the car straight. Then seventh, inaccurate cornering. He has to turn, and you can see that instead of turning like this, he has come almost to this corner. Then number eight, tendency to drive in the middle of the road instead of keeping left or right, depending upon the rules of the country. He's driving in the middle of the road, which is not the rule in any country. And then number nine, uh, bad judgment. There's a car in front of him. Instead of moving aside, he continues to be there, drive in straight ahead as if he is prepared for a collision. And number 10, increased, increased persistence of the dazzling effect, or decreased uh, recovery from the dazzling effect. Has come in front of a car which has its headlights on, and there is a dazzling effect, but that continues much longer than it normally does. And the 11th, he has a long reaction time, and therefore he doesn't stop in time at the red light and may jump the red light or may go and hit the car in front of him. Now, behavioral effects of alcohol. We saw the effects on driving. Now, the effects on relationships. These are easy to understand because as the person becomes more and more dependent on alcohol, uh, he and because of his behavior, people try to keep away from him, and relationships everywhere at home, at the workplace, among friends, those relationships suffer. And the more a person gets isolated, the more he feels the need to drink, setting up a vicious cycle. And the effects on relationships have again been brought out in the next picture from the same book on pharmacology, clinical pharmacology. When I studied it, it was the third edition. This is the eighth edition, and now the book has gone into the 12th edition or something. And Dr. Lawrence, who passed away a few years back, has been joined here by his students. Uh, but hopefully these pictures still continue. These pictures are from the third edition, which I studied. These are the 19 stages of alcohol dependence. Starting with occasional relief drinking, the person goes on to constant relief drinking and then surreptitious drinking because he can't drink openly at the workplace. And then he realizes what he's doing is wrong. He still has enough sanity left. So he has feelings of guilt. But then he finds it unable to discuss the problem with anybody and may get into trouble with the law, may get arrested while driving under the influence of alcohol or for some other minor crime. And then he loses control completely. He says, I can't help it. I'm helpless. I have got to drink. This is my fate. And then sometimes he displays psychiatric problems like grandiose and aggressive behavior, makes promises to himself that I will not drink anymore, but all these promises and resolutions fail. And then he avoids the family and friends, and the family and friends start avoiding him. He has problems with work. He may lose the job, and he has financial problems, and he has uh, uh, too many resentments, unreasonable resentments, because he starts finding scapegoats. He finds excuses in the outside world for his poor plight. मेरी किस्मत ही फूटी है, मेरे साथ मेरा सब बुरा चाहते हैं, कोई मेरे साथ ठीक तरह से बिहेव नहीं करता, कोई मेरा फ्रेंड नहीं है दुनिया में, एंड सो ऑन एंड सो फोर्थ. That sort of behavior. I have no friend left in the world. And he neglects food. Alcohol interests him much more than food. And then moral deterioration. Again, a girl coming in, as if that's the only immoral thing he can do. And then impaired thinking and unable to initiate action. So all the files have accumulated in the in tray. He's unable to take any action on them. Therefore, nothing enters the out tray. And then he sometimes starts having vague spiritual desires. That can also sometimes happen, but then they remain vague and no action is taken on those desires. And finally, when he finds that he can't do anything spiritual either, so complete defeat is admitted and he becomes a compulsive drinker who's drinking all the time and he has severe alcohol dependence. These are the 19 stages of severe alcoholism. Now, as we can understand, this then leads to all types of crimes, particularly because if the person is inclined to a crime and he has seen on in a film or somewhere some crime being committed, he feels like doing it, or he has planned a crime, he may have some sense of guilt, some hesitation, some hesitation because of the risk involved. But under the influence of alcohol, because of the loss of inhibition, all that tends to disappear. So it's easier for him to commit a crime under the influence of alcohol, and therefore sometimes he takes a drink just before committing the crime because he knows then he'll be able to do it boldly with great courage, whatever that courage is worth. And that's how very often these people, in fact, have a good drink before they go and they commit the crime without feeling guilty, without being afraid of the risk involved. And sometimes the crime may be taking their own life. I don't know whether suicide should be classified as a crime, although legally it is probably still classified as a crime. But all the same, he may not be violent with others, but he may take his own life when he finds that he's a gone case, nothing can help him, nobody can help him. Now, this is another question which some of you might be having. Is the liking for alcohol inherited? It's not 100% inheritance that if the parent drinks, the child will definitely drink. But there's a tendency which is inherited. It's a polygenic inheritance, which means it's not dependent on one gene, but a number of genes. And all of the genes are not likely to be together in a cluster in the same person. But all the same, a tendency to like alcohol can be inherited. And that can be taken as an excuse that I drink because my father used to drink. But it can also be taken as a warning that if my father drank, I may have this gene and therefore I may have a tendency, so I should not even touch it. Once I touch it, I might get hooked to it. So it can be taken either as an excuse or as a warning. That depends on the person. Still, that conscious choice can be made. Secondly, just as there are genes for liking alcohol, there are also genes for disliking alcohol, which happens generally because the tolerance to alcohol is less in these people. And they can't tolerate much of alcohol. They get unpleasant effects with very small amounts, and therefore they are less likely to take to alcohol. And also, one has to keep in mind that inherited does not necessarily mean that it is genetic in nature. Because if the person has seen in his environment, particularly in the home environment, that the father is drinking, then that influences the person. The person thinks it's all right to drink. And therefore, it is not just inheritance because of the genes, it's also inheritance because of the environment in which the child has grown up. And in the same way, if a child has grown up, even if the parent, and I know at least one such case, even if the child has grown up in a household where the father probably had this gene because the grandfather of this boy drank. So this person's father, this child's father, took it as a warning. If I touch alcohol, I might get hooked to it. He did not drink. Because he did not drink, the son did not drink. Although the son might also be having the same genes. So inheritance is not necessarily genetic. The environment can play a strong role, interact with the genes to either make the person drink or make a conscious choice not to drink. So inherited is not the same as genetic. Yes, there are genes for liking alcohol and genes for disliking alcohol. And the genetic tendency to like alcohol, may be used as an excuse or as a warning. Now, how much can a person take, if at all? Please be careful. I'm not saying that a person should have this much alcohol. I'm just talking about the safe limits in general. There can be exceptions. Some people may be a little more tolerant, some may be a little less tolerant. But in general, for men, a beer up to 2 glasses, that is 200 ml each glass. So up to 400 ml of beer, wine up to 1 glass, 200 ml of wine per day, whiskey up to 2 pegs. One peg is generally about 30 ml, diluted to 200 ml or so with water or soda or something. So these are the so-called permissible limits for men. For women, it is only half the amount that is permitted because their tolerance in general is half as much. So some men uh, can have more of the feminine in their personality and in their biological makeup, so they may be less tolerant. And some women may be more manly and may be able to tolerate more. But in general, women can tolerate only about half the amount permitted for men. And certainly, for reasons which we have discussed earlier, they are not. It's not advisable for them to take alcohol, at least during pregnancy and lactation. And alcohol should not be mixed with many drugs. Two of the commonly used classes of drugs are the painkillers like aspirin, because both can cause gastritis, and the two together can lead to bleeding in the stomach, which can be fatal. And antihistamines, which are used for common cold and allergies. And of course, alcohol should not be mixed with driving. Alcohol is also not permitted if the person already has high blood pressure, heart disease of the type in which there are arrhythmias, like, first degree heart block, second degree heart block, and so on, arrhythmias, and liver disease, peptic ulcer, sleep apnea, or breast cancer. It's also not permitted because of drug interactions. If a person is taking sleeping pills, tranquilizers, because the effects can get compounded and the person may go into deep unconsciousness and may even die. Also, some blood thinners and anticoagulants, antidiarrheals, antifungals, anti-epileptic drugs, and antidepressants may interact with the alcohol in a way that is dangerous. Now, how can one manage a social situation where many people in the party are drinking uh, and this person does not want to drink? Uh, Luckily, now water has become a more and more acceptable drink in itself. So one can take water, that is the best. But next best would be to have as little of alcohol as possible and as much of water as possible. Dilute the alcohol, and after the glass is only half full, dilute it further with more water so that hardly at the end there's hardly any alcohol left in the glass. It's almost all water. To start with, one can take a 50-50 mixture of beer and soda. That is another trick that some people use. And one should not be in a hurry to finish the glass. Sip slowly, keep diluting it with water. And most important is to have the courage of conviction, not to have this feeling, FOMO, feeling of missing out. Now, sometimes in stress, people have this type of an attitude. I know drinking is not the answer to my problems, but it's worth a shot. Hmm? I doubt vodka is the answer to my problems, but it's worth a shot. Hmm? But then we've seen what the risks of treating it as worth a shot are. The problems were not solved, definitely, but the person gets hooked to the alcohol, which compounds the problems that the person already had with problems created by alcohol itself. Now, what if this person realizes that the problems are not getting solved by drinking? The person has already become fairly dependent on alcohol. This person is likely to get severe withdrawal symptoms. And these withdrawal symptoms are some of the common ones are nausea, sweating, anxiety, trembling of the body. And some of these symptoms can be dangerous enough. Uh, and therefore, quitting is advisable only under medical supervision. And although There are at least three drugs known which work in different ways. Some create an aversion to alcohol, I was talking some time back, and some reduce the craving itself by altering the neurotransmitter balance in the brain. But that is only to start with and under medical supervision. But eventually, what is most important is love and understanding of the family. Because in the absence of that, very few alcoholics recover. And even if that is not there, the person can become completely independent of anybody else's love and understanding if the person can look at this situation from the spiritual point of view, look at it through the spiritual lens. Here I may turn to an organization which actually does exactly that. Looks at the issue from a spiritual point of view. It's a support group for alcoholics called Alcoholics Anonymous because right from the beginning, one of the principles of this organization has been to remain anonymous. Not the organization, but the participants in the organization remain anonymous because they're not looking for name and fame and an ego boost. They don't want to be known doing something. Alcoholics Anonymous. The nickname is double A generally, which is used. And it was formed in 1935, 88 years ago. And the key people in establishing it were Bill Wilson and Bob Smith, who were both themselves alcoholics. Bill Wilson uh, recovered as a result of the intervention by a group which was called the Oxford Group, which was a religious group. They were depending upon religion. And he tried to help a friend of his, Bob Smith, who was a surgeon, who was also a severe alcoholic and had an intense desire to quit. So Bill Wilson tried to help Bob Smith through the same type of approach which had helped him in the Oxford program, a religion based approach. But then, when the two discussed, they found that they came to the conclusion that a religion based approach may not suit many people. Why not make it a little more non denominational, which means move away from religion towards spirituality? So they came up with another set of principles, a program which drew a lot from the original program which Bill Wilson had done, but was more spiritually oriented and rather than religious in nature. And they named this support group which they tried to form double A. And they wanted to restrict it to nobody. They wanted it to be a worldwide thing. And the result today is that it has, although the headquarters are at New York, it's a worldwide organization. And its membership in 2020 stood at more than 2 million worldwide. They have a website, and they have a book which was created soon after this was came up, but then new editions keep coming. The book is also Alcoholics Anonymous. Now, now here you can see that one of the things which both these persons did was that when they benefited, they did not stop there. They wanted to help somebody else. Bill Wilson wanted to help Bob Smith, and both of them together wanted to help a much larger number of people who were affected by the same problem. So, in fact, the essence of spirituality is thinking beyond your little self, and instead of exclusive attention on oneself or one's near and dear ones, feel connected to everybody, realize that sense of connection, that sense of interrelatedness to everybody. And anybody who has a problem, had a problem of the type that they had conquered, they wanted to help those people. And that was at the root of this organization. Now, let's see what are the 12 steps that they came up with. Firstly, I mean, they, as a principle, they decided it will be a non-professional, non-denominational, apolitical, and unaffiliated organization. And the 12 steps that they came up with was that firstly, admit being helpless. Realize that you are helpless and unable to manage your own life. But at the same time, you are unable to manage it, but there is a greater power that can help. Call that greater power by any name. And if that power exists, hand over your will, personal will, and your life to that greater power. And then go in for a sin. Don't expect that that higher power will do everything for you. You also have to do something. And what is it that you have to do? A sincere heart searching for one's moral inventory. Where all have I gone wrong? Admit one's mistakes, admit follies to ourselves, to others. Don't feel embarrassed in admitting to others in the group at least. and to God, that higher power. And then be ready for God to cure us, which means be receptive to the force of God. And having become receptive, request for God's help. Then make a list of all those who you have harmed in one way or the other, resolve to make amends. Don't just resolve, actually make amends wherever it is possible. And then this moral inventory which was made is not something static. As a person is improving, the person may have less of undesirable moral traits or immoral traits left, but same time, perfection is far away. And therefore, continue this process of keeping on making fresh moral inventories of yourself. So, this heart searching should continue. And to deal with that, maintain a conscious contact with God, which would mean conscious contact with the divine essence of the person, that is, the person's deepest self or the soul or the dynamic aspect of the soul, which Sri Aurobindo and the mother call the psychic being. Maintain a conscious contact with that entity, which knows all and which has all the light and the force and the love of God. And then carry these steps to others and let these life, guide your life using these 12 steps. Carry these steps to others who are afflicted by the same problem of alcoholism. But then, being human, they found that they had difficulties. But before you come to those difficulties that they had, here is a relevant quote from the mother. Before thee, that before the divine, before God, may my heart be pure as a pure crystal, so that wholly it may reflect thee. Because the divine knows all. किससे छिपा रहे हैं आप? उनको तो सब पता है. So, when you offer your weakness, offer your follies, offer your moral imperfections to the divine and request God's help, be completely sincere and open. Don't try to hide anything. Let the heart be like a pure crystal so that it may reflect thee. When it achieves that sincerity and purity, it will start reflecting the divine within. It will become a reflection of the soul. Now, being human, they had problems in spite of these 12 steps as the organization grew. And then they came up with 12 traditions. And these traditions are firstly, that the common welfare comes before the person as an individual. There's only one ultimate authority in the organization, and that is God. Membership needs only the desire to stop drinking. Anybody can be a member, but then the person should have been an alcoholic in the past and should have a sincere desire to stop drinking. That is the only requirement for membership, not how much the person can pay. Each group is autonomous. Each group in the world is autonomous. Each group has a common purpose. The purpose is common, but enough autonomy to take care of the local conditions. Do not lend name to others, which means do not form associations with others, lend your name to others who may dilute your agenda. It should be a self supporting organization which should be supported only by the members. They can make voluntary contributions, but do not accept any contributions from outside. It should maintain a non professional character and remain relatively unorganized. We call it a benign anarchy. And the organization should not express any opinion on outside issues. It should remain apolitical in nature. And it should attract people because of the work that it is doing. It should not try to promote itself. So AA should not try to promote itself as an organization. It should depend more on its ability to attract. Through its work, it will get known and attract people who are in trouble, who want this type of help. And remain anonymous. The organization should remain anonymous. The individuals working for it should remain anonymous. Anonymity is the spiritual foundation of this organization, and principles of the organization remain above personalities. Now, these are 12 traditions, not only of AA, but if you look at it, actually, these are the 12 things which can help any organization anywhere in the world live long and stick to its ideals. And it is the violation of some of these principles which often leads to the decline of organizations, institutions, and so on. Now, here's a quote from William Penn, and that is what I'll end with. All excess is ill, but drunkenness is of the worst sort. It spoils health, dismounts the mind, and unmans men. It reveals secrets, is quarrelsome, lascivious, impudent, that is, increases sexual perversions and makes the person rude. It's dangerous and mad. In fine, which means finally, this is old English. He was living in the 17th century. In fine means finally. He that is drunk is not a man because he is so long void of reason, which means he's so far removed from reason. That distinguishes a man from a beast. You'll find quite a bit of this material in these 10 pages of this book, Back to Health Through Yoga, published by Rupa in 2008 and still going strong. Gratitude to the Mother and Sri Aurobindo for their infinite grace, which makes these sessions possible. And if you have any questions or comments, you're welcome to send an email to yes@yesspirituality.com. And if you haven't already done so, please visit and subscribe to the Yes Spirituality YouTube channel, on which all proceedings are uploaded, including these talks. Thank you all for being there to listen.
Thank you so much, sir. Thanks a lot for sharing your knowledge and wisdom on a very important topic today. It's helpful to everyone, I'm sure.
Thank you.
Participants, if anyone has a question, anyone wants to share something, please go ahead. I see Richa has raised the hand. Please go ahead, Richa.
Namaste, sir. Good evening. So, I have a small reflection to share with you. This was a very insightful session. I remember I was studying in a boarding school, and boarding school is a place where vices like this can crop in very early. I was in an all girls boarding school, so during 11th and 12th, there was a lot of peer pressure around, trying new things. So, girls would try smoking or drinking, and they would force the more sincere students, chalo ise bigadte hain, let's try to spoil this child, right? So I faced a lot of pressure as a result of that. And if you do not conform to such kind of pressures, then um, youngsters would label you, your peer would label you as being not cool enough, or being very backward, or things like that. And of course, I was very lucky to have very strong value systems from my family. Like my parents had instilled that kind of, not all children get that kind of a support from home. So when I grew up as a psychologist, I realized that it is very important for parents to have conversations with children early on. So I mean telling them that these things exist, lots of addictions exist, and this can have harmful effects, instead of saying a straight away no, ki, you should never do this, because completely stopping or prohibiting them creates a lot of curiosity in children to try and explore. That is one thing I discovered. Another thing that I discovered is a lot of teenagers that I work with currently also resort to such practices as a mode of rebellion, to rebel or to shame their parents or to take some kind of revenge against parental authority. So these are two different extremes, curiosity and rebellion. And drinking perhaps starts very early on, mostly as a result of peer pressure or due to an inability to navigate through one's life's challenges. So not being able to take in the challenges that somebody is facing as a young adult or as a growing up adult. Okay. So I feel teaching from beginning by parents, by school authorities, from an early age, providing enough resources for children to learn life skills that can help them navigate their stressors. And also one thing which I suggest my students is that whenever you come across a peer pressure on alcohol or drugs or these kind of things, make your parents the villain. They are the safest villain. So just blame them. Tell them my parents are going to kill me like anything. I just can't do this, man. So that's the safest resort. You take advantage of that kind of level. Like blame any guardian or authority figure that you have in your life. And if you're courageous enough, and if you understand that showing ourselves as cool is a very cheap kind of a bargain to do, and you're very happy and confident in your own self, just say, okay, I'm not cool enough, I don't care, I do not need to be cool, I do not need to do this to appear cool in your eyes. I'm perfect the way my coolness is in books or my hobbies or in art. I'm a different kind of cool. So I felt that these are few practices that work for me and work for my students that I work with respect to such areas. So thank you. This was very insightful. I really loved your whole session. The title was very interesting, and the guidelines with respect to AA and all the protocols, etc. It was very insightful, sir. Thank you.
Thank you, Richa, for raising that point. Uh, and as a psychologist, in fact, you have also answered your question much better than I could have done. I can only add one thing, and that is make parents the villain, and sometimes maybe you can make doctor the villain. That I have a disease and the doctor has stopped me from having doing this or that. So maybe that might also be helpful. But certainly at that stage, probably it's not prudent on the part of that young person to try and give a lecture to the peers and tell them all the harmful effects of smoking and drinking. That is something that can be left to the teachers and other mentors and their parents and so on, rather than this youngster trying to do it herself. What do you think?
Yes, sir, absolutely, absolutely right. But yeah, children need to believe in themselves enough. They need to be very strong and self-confident themselves. So yeah, I agree with you.
Yes, that courage of conviction is what's important.
Yes, sir, right.
So that you do not get hurt by feeling left out. But at the same time, it's not just feeling left out, it can almost amount to bullying by the peer group. And that is what makes it difficult to deal with. And then you have given some very good solutions to it.
Thank you, sir. Yeah.
Participants, if anyone else has something to share or any question, please go ahead. You can put the question in the chat box.
May I, ma'am?
Yes, please go ahead, sir.
Thank you very much. Good afternoon. Thank you, Professor Bijlani. It was a wonderful lecture, and you have given us input about medical and social aspect of drinking and alcoholism. I want to take all of us to a new direction where a group of spiritual seekers, they are called as Aghori. I think you might have heard, most of us. They use a lot of alcohol for their worship purpose and their spiritual attainment. So I don't know whether it is psychologically or medically good for them or not. But if I have interacted with them, and they say that it is mandated for them to have drink not only themselves, but they will offer to their deity also. So in fact, just like food, alcohol is one of the essential ingredients in their day-to-day life and in their worship and in their spiritual seeking. So of course, medically and socially, we all are aware, and of course you have given every aspect of alcoholism on medical issues. But the spiritual seekers have a different understanding about taking alcohol, and that they call is a must for their worship, their meditations, and also their practice of certain mantras and certain, level of worshipping. So I just add that this is also one of the group of people who always thinks that yes, alcohol is required for their all kinds of spiritual seekings, and without that it is not at all possible. I just want to hear the remarks of Professor Bijlani. Thank you.
Thank you, Professor Yadav. Let me start with one of the last things you said, that these type of groups think that it is not possible for them to go in for worship or their devotional practice without drinking. Now, that certainly can't be true, because there are so many who do not drink. Those who do not drink on the spiritual path is much more than those who drink. So it means either the others are not doing the right thing, or they are all disqualified from true devotion. So that certainly is not true. But all the same, the tendency to do this is not something which is sort of believable or unimaginable. It falls within the framework of reason. Why it does so is because any type of devotion means that you suspend your normal ability to think and reason, and you are so taken away by emotions that uh, everything else is forgotten. You are completely, totally absorbed, whether it is devotion to God or devotion to the beloved as a young person, or whether it is devotion to work or whatever it is. Any devotion means an exclusive attention, exclusive emotional investment, to the point that everything else becomes secondary. Now, if a drug helps in achieving that type of a state, we saw that alcohol does help in achieving that type of state, because it inhibits the parts which inhibit, the parts which think. It depresses those parts. So alcohol can do that. So not only alcohol, but many other types of drugs have also been used in the same way, like on Holi particularly, say bhang, or some other drugs have been used by the hippies to get a high, dam maro dam. You remember those scenes? So smoking those type of drugs. Now, what these are doing is basically altering the neural function, which is producing a type of state which is similar to what is thought to be the state of a devotee or a person getting a spiritual realization. Now, to achieve that as a result of a normal spiritual practice is one thing, and to try to duplicate that type of a mental state or neurochemistry through a drug is another. What is the main difference? The most important difference between these two ways of doing it is that when a person does it the hard way, that is by walking the spiritual path without depending on any drug, then the person emerges as a better person. The person is changing as a whole. Whereas when the person is using a shortcut, like a drug, be it alcohol or any other drug, to achieve a similar mental state, the similar euphoria, a similar intensity of devotion, or whatever it is, when a person is trying to do that, then actually the person as a whole is not changing. He's just concentrating on the joy that he's getting, on the pleasure that he's getting, on the fleeting pleasure that he's getting, because it will last only as long as the effect of the drug. And that's why he can also get addicted to the drug. And he will not admit it. He'll say that it's necessary for my devotion, but he will not admit that he's addicted. So he's becoming dependent on the drug for producing that, but as a person, he's not changing. Actually, as a person, he may get worse, because this dependence might lead him to crime, which he may not have otherwise committed. So instead of becoming a better person, he may end up becoming a much worse person. So therefore, that is where difference lies in trying to alter the neurochemistry of the brain, or trying to use a drug which affects the brain in the same way as might happen in the normal course when the person is pursuing the spiritual path. That may be difficult, that may be slower, but that transforms the person in the positive direction. Using this chemical aid transforms him in the negative direction.
Sir, if you allow, I can just supplement bit 2 to 3 more points, not more than that. One thing is that it requires little more discussion, because if we discuss with them, they have a different arena of thought that we should welcome, number one. Number two, alcohol being a part of their spiritual seeking is not something which is suddenly embedded in the protocol. Rather, it is persisting for many generations of their section. Number two. Number three is that they are of such a nice person and nice quality of people. Of course, in the periphery, there are many other pseudo type of personalities who may commit crime, and they can blame the section, but they are such a highly learned and highly connected group of people that they can, get happen anything which they wish to. So my point of view is that, of course, I agree partly with your observations, but still we need to have more discussions, and maybe someday we can discuss. But what I wanted to just supplement is that this is not something which has come in their protocol suddenly, or by interest, or just to make happy somebody is taking. It is their protocol, and that section has that protocol. So that is persisting for many generations. Thank you.
Well, the fact that it has not come suddenly is not surprising because, as they say, there's hardly anything new under the sun. What the ideas which people get today, the people got also thousands of years ago. So the fact that they did it long back does not mean that it is surprising. And if it happened long ago, it will have a long tradition. Now, having a long tradition by itself does not sanctify it or prove it, but certainly we can respect that. And when it comes to that, some of them can be very nice people. That I can fully accept, because not only those who are openly spiritual seekers and are using this as a part of their sadhana, even normal worldly people who become addicts to alcohol, I have known so many of them, were otherwise very fine human beings. So I'm not condemning them as people. I'm condemning their habit. I'm trying to bring out the negative effects of the habit. I'm not condemning the class of people who are addicted. Some of them are very fine human beings. I've known them.
Thank you, sir. Thanks a lot. Anyone else has a question? Check the chat box once. No question as such. Thanks again, sir. Thank you so much for sharing your valuable time and knowledge with all of us. I thank the participants as well for being with us today. We can close today's session with a moment of peaceful silence. Namaste.